Ready? Thank you, Madam
Dr.
Chair.
Cashwell.
Yes, thank you, Madam Chair, members of the board. The first item I have is our Health Committee update, as is customary at each of our meetings. And so Dr. Tigan's coming forward. I see Mrs. Gilbert's always with us as well, as usual, and we're pleased to have them come forward and provide the latest information related to our Health Committee's work. Dr. Tigan.
Yes, good afternoon, Madam Chair, members of the board, and Dr. Cashwell. I appreciate this opportunity each meeting to update you, our staff, and our families on the work of the HCPS Health Committee. It has been a busy several weeks with the return of even more students to in-person learning. This week, we welcome back our 7th, 8th, 10th, 11th, and 12th grade students, completing the return of students pre-K through 12. The last two meetings of the Health Committee were focused on sharing new guidelines from the CDC and the eventual adoption of that new guidance by the Virginia Department of Health, reviewing the HCPS COVID-19 health plan to identify changes needed to reflect this current guidance as well as practices, updating the committee members on the plan for first and second vaccines, discussing the impact of athletics on in-person learning, and discussing the updated Health Updates webpage. Let's dive into each of these focus areas and the new CDC guidance shared 2 weeks ago. At the March 1st HCPS Health Committee meeting, this was after our last school board meeting, the Virginia Department of Health informed me and Ms. Gilbert that the VDH had yet to adopt the new CDC guidelines, and they were still relying on the 14-day time frame and 5 levels of community transmission. It was not until last Friday that we learned that the VDH had adopted that guidance, and so they also provided some clarification to previous guidance they had provided. And we'll go through that today. As shared 2 weeks ago, when referencing the new CDC guidelines, the core indicators are the 7-day total of the number of new cases and the percent positivity. That is now in alignment with the VDH. The decision matrix includes 4 levels of transmission, ranging from low to moderate to substantial to high, and takes into account the level of impact of transmission within schools. The VDH has also provided additional guidance, or rather clarification, around community transmission. And let's look at what that means for Henrico data that goes back to March 6th. This is the most current data as it's being provided each week that goes through Saturday of each week. And it's usually posted by Tuesday mid-morning. As you can see from the graphs, the number of new cases and percent positivity are decreasing sharply. The total number of new cases per 100,000 persons from February 28th through March 6th was 116, and the percent of positive PCR tests during the same time period was 5%. All in all, this is very good news. So let's transition to the decision matrix and see the new tool shared with schools yesterday. The transmission levels listed across the top row of the decision matrix for school reopening and phase mitigation mirror the CDC guidelines shared at the last school board meeting. The transmission levels, again, you will see range from the blue, which is low, up to the red, which is high. You will notice, though, the addition of the first column, which relates to the level of impact to a school. The indicators to consider when determining the impact of level include the 3 secondary indicators that were shared previously. So they've combined those on this matrix. The first index is the transmission within school. And so it runs from low to medium to high and is based on the number of cases as well as outbreaks within a school. The low level, there are 0 or sporadic cases with no evidence of transmission in school. Medium level, there are 2 outbreaks within a short period of time, or sporadic outbreaks in schools. And the size of the outbreaks remain relatively small. And as a reminder, an outbreak just needs to be one case leading to a second case that are connected. In the high level, there are several outbreaks in schools within a short period of time. The size of the outbreaks is large, or the scope of the outbreaks is considered significant. The second indicator is tied to student absenteeism, and that's related to using the current baseline as a low, ranging up to being slightly above baseline as medium, or well above baseline as high. And the third indicator is related to staff capacity. Again, as we've shared previously, this is rather subjective, and it deals with being able to keep operations at school working. So it's related to teacher absenteeism, substitute fill rates, and it can go from where the normal level is low. Medium is when we start to feel the system is being strained, where high is when it's getting critical. So this information was shared with divisions yesterday as to how putting this all together at this point. And, while the indicators we've seen before, really looking at how those apply to the new in-person learning, we have more students that have been coming in over the last 3 weeks. And so I have not shown these indicators today as they apply because we're still trying to establish baselines with the number of additional students coming in person. And so here you're seeing the low impact and medium impact versus the low, moderate, substantial, and high transmission. And this is continued on a second slide here so that it would be able to be read by people. Here's the high impact, and it explains exactly what the impact is on schools. And so that's the new decision-making matrix that was shared. And so here is Henrico County's 7-day timeline data on March 6th that indicate that the new cases are at high transmission and the percent positivity is at moderate transmission. While in the past we have averaged the 2 different transmission levels and would have said we are in about the substantial range, the VDH is now indicating school divisions should be using the higher of the 2 different transmissions level. Thus, our overall transmission would remain in the high level. Over the next 2 to 3 weeks, again, staff and student attendance data will be reviewed to establish our new baseline levels. We will then be able to more accurately determine the transmission level using the revised decision matrix. And we also know, again, current student enrollment levels are fluctuating daily. In addition to monitoring guidance changes, we are also assessing changes in practice as a result of the low return rates of our students. And based on the changes in guidance and practice, the HCPS Health Committee is recommending several revisions to our health plan. One of the changes impacts a few select schools as it involves the student lunch venues. Some schools have so few in-person students at a grade level that the students can actually social distance 6 feet or more within the cafeteria or gym. In these cases, the administrators have arranged student desks with desk guards in the common space for use during lunch. The ability to monitor the students in a larger space allows some teachers to have a duty-free lunch. And so the committee supported this change, and the plan will be updated to reflect this. There was also conversation about parent volunteers. Schools have been permitted to allow parent volunteers to assist with outdoor activities. This is in alignment with the current health plan. The committee does want to continue the conversation about when and how it is safe to have parent volunteers inside the schools. A subcommittee is engaging other stakeholders, including parents, in this discussion. There was consensus that any plan would be school-based and require the administration to determine the ability to have additional folks within their school. This work was delayed by some of the inclement weather we had. And there was a review of the face mask expectations. It was decided to provide more specific language around the number of layers needed for a face mask and the expectations about double masking. Cloth face mask must be multi-layered, thus bandana and neck gaiters are not acceptable. It is also important to note the CDC states that masks with exhalation valves or vents are also not acceptable. The CDC and VDH are still not embracing the idea of double masking, thus we are not recommending double masking. The last area of revision pertains to seating on buses. The current version of the health plan stated siblings would be allowed to sit together on one bench seat without the need for social distancing. This would be revised to say that siblings will be required to sit together, and this is a result of recent situations brought to light through contact tracing. While the focus for many has been on the return of more students to our classrooms, efforts are still underway to vaccinate our staff wishing to be vaccinated. So at the Health Committee, we discuss vaccinations. Our nurses continue to support the vaccination efforts at the Richmond Raceway. They are primarily working outside their school hours to support the efforts to immunize those in need within the Henrico Health District. This week, they help administer the Johnson & Johnson vaccine, which was recently approved by the Food and Drug Administration. We also have key office staff working with the Emergency Operations Center in the Virginia Department of Health to schedule new hires for their initial dose of the vaccine, as well as those being scheduled that still need the second dose of their vaccine. This has been complicated as we try to match manufacturer from first dose with when there's an opportunity to have that same manufacturer for the second dose. While the number in these two groups is definitely shrinking, I anticipate needing to schedule new employees from now through the end of the school year and maybe even into the summer. The nurses continue to assist with contact tracing, and much of their time is devoted to investigating cases related to athletics right now. And so the fall sports season has resulted in an influx of cases from the community. The contact tracers work closely with school personnel and parents. One of the challenges faced has been inconsistent information from coaches, students, and parents. And while the cases seem to be from community spread, the mitigation strategies within our schools has helped prevent that spread from entering our school buildings. But the key message is students need to focus on these same key mitigation strategies outside of school. In an attempt to continue to reinforce these factors, the health updates page on the website continues to be enhanced. And here to show some of those enhancements is Mr. Jenks.
Thank you, Beth. As we shared 2 weeks ago, the school division's commitment to public notifications and reporting of positive COVID-19 cases is ongoing. Dating back to last August, any time an individual who had been on our property reported a positive case to us, we listed that case as well as the last known date that the individual was in one of our buildings, campuses, or offices. Since we last met here, a number of updates and changes have gone live for our employees, families, and the general public to see. For example, we are now reporting new data based on increased in-person learning, updated weekly for instruction, as well as athletics and extracurricular activities. This includes not just the number of positive cases, but also the number of contacts from those positive cases, the number of outbreaks between students and staff, staff and students, and locations where these positive cases were reported. For those who may be listening in, you can find it by going to our main website and clicking on Health Committee Updates, which is listed on the homepage beneath Hot Topics. The public reporting on our website is in addition to the school-based notifications that go out from a principal every time. Also posted under Hot Topics, we've been updating and communicating the existence of resources that include our new video toolbox, which now includes 12 short clips on the ways that schools look and operate differently. Aside from the web, these resources are being emailed and posted to our social media. Schools are aware of these resources too, to be used additionally at their discretion. Beth?
Thank you. So as you can see, the Health Committee continues to review current practices to ensure protocols established earlier in the school year continue to address needs and maintain the health of our students and staff. Ms. Gilbert, Mr. Jenks, and I are happy to answer any questions you may have.
Board members, any questions? Ms. Kinsella, we'll start with you and go that way.
Yes, I appreciate the update, especially on the athletics piece of this, because I've heard from concerned parents really that their concern is about schools remaining open and accessible to their children. How many, because just for those listening that haven't gone out to the website yet, how many athletic teams have had positive COVID exposure? And how many have needed to quarantine to date?
I know Ms. Gilbert was here. I think she's armed with that information.
We have had approximately, good afternoon. We've had approximately 25 teams affected and over 250 exposures subsequent to that. As we work through those, we try and get the children back into school as quickly as we can, if we can exclude those, and move them out of the tracer.
Okay.
But of course, when you have a positive player on a team, it takes out your entire team. When the team plays another team, then you have the other team affected as well.
Okay.
What we have been very fortunate about with Ms. Kinsella, is that our positive cases on our teams have not resulted in any subsequent positive student athletes. So while a positive case may have exposed someone because in the nature of playing a sport, you come within that 6-foot distance for that period of time, our mitigating interventions, our good mask wearing, our good hand hygiene have benefited us in the fact that we have not had a linked case.
Okay, thank you for that. And then I know that, I guess before, when we've spoken about contact tracing before, are there different expectations for principals, IAs, monitors, and lunch monitors in terms of trying to assist and going around buildings, because as long as they keep distancing?
Are you talking about?
Here's what I'm asking, like how, because my follow-up is going to be, what does it look like for our principals, IAs, monitors, and lunch monitors? Because they're going around to different parts of buildings for different periods of time, if you will. However, I've heard some concern about why is the LAMP staff still virtual if these other activities can take place in a building safely with our principals, IAs, monitors, lunch monitors. That's what I'm trying to distinguish. Like, do we expect any changes there?
I can tackle a piece of that, particularly related to LAMP. And so we have looked at that situation because of the unique nature of, particularly you're talking about the elementary school level. For example, an art teacher serves all grade levels, not just one class. One of the considerations is with the number of students that art teacher or librarian or music teacher serves both virtually and in person, it's the nature of the instructional delivery that's driving the virtual piece there. The logistics of making sure that that one teacher is still able to serve during the school day, both the virtual and in-person students, we're leveraging that virtual hybrid parallel model.
Okay, thank you for clarifying that. I've had some folks message in and allude to the contact tracing and our mitigation. So it made sense. They were asking, why can't this happen? So thank you for explaining that related to instruction, not contact tracing. And that's all I had. Thank you.
You're welcome.
Thank you, Ms. Kinsella. Ms. Shea?
Thank you. I'm still trying to wrap my head around this new decision matrix, and as it was new yesterday, I may just have to circle back with you later when I can process it a little more. Unfortunately, it seems to me that this makes it more fuzzy, not less fuzzy. Is that
I would agree a little bit, yes.
okay? It's not just me.
And I think
Okay.
it could be too, just because it's so new.
It's so new.
There are components that we've seen before. It's just how they're putting it together and how it's, how we're applying it. So, I think the fuzzier piece is going with the highest, not looking at the picture in totality, that makes it a little more difficult from my perspective.
And remind me, is this, I know the CDC and VDH have different not diverging, but different matrices right now. Which is this?
This has actually been adopted by came out from the VDH, but it is grounded more so in the CDC because it's, from the standpoint of it's tied to the 7-day rather than the 14-day total. And it's using the 4 levels of transmission rather than 5. So they've really taken what they had previously and tried to blend it with the key components of the CDC.
And yeah, so sorry. When I look at all these and all the parts that go into the different parts and the secondary and I tried to write as quickly as I could as you were going through. I didn't anywhere explicitly see mitigation in the building, more the outcomes of mitigation in the building. Is that correct?
It's still, though, part of it is knowing that those 5 main mitigation strategies are still in place, those layers, and then, of course, we know we have additional layers, but this is still grounded in those 5 key mitigation factors.
Okay. I'm going to have to process this and loop back.
I'll send you some more information.
Oh,
that might help.
I love that. Thank you, Dr. Tigan.
You're welcome.
And then when we look at the use of parent volunteers for outdoor activities, particularly for elementary school, would it be possible or reasonable to perhaps use some of those parent volunteers for recess, which could provide the teachers with a little bit of unencumbered time during the day for a restroom break or, anything else that they would usually do during LAMPS time?
That is one of the things that's being considered.
Fantastic. I think that is, and then my other thought was, I appreciate this new reporting, Mr. Jinks, on the webpage. When I look at it, it is spreadsheets and boxes that have the most current information. Are those cumulative by school? Like, before it was, this date, a student, one student, whatever. But now it's just one box. So we can't list separate instances, if you will, in the same box.
That's correct. It's cumulative because the thinking is as the days and weeks go on, it becomes increasingly less relevant that a school had one case 4 weeks ago and more relevant publicly that a aggregate number of cases has occurred at a given building, considering as well that each and every time an instance occurs, that community is also being informed as well.
Perfect. I don't know if this is website information, but for my information, I also, not to make anybody do anything extra, but as y'all are processing data, I think it's really important looking at, I know we have the number of student to staff outbreaks in there, but also understanding how many we had. So we had 1 positive case, which led to 12 contacts, but how many of those contacts led to a case? Does that make sense? Like, that extra piece, to me, that's evidence of how our mitigation is working. And I think that's a really critical piece of information when we look at the safety of our schools.
We can go back and look at that and see if we can add that.
Again,
into
I really don't want to add
it is
another layer. But.
What we know anecdotally when we say about the athletics, where we know cases that were positive haven't transmitted across to other players or come into the building. That is key information.
Right.
And we know it anecdotally, but it's not visible to our families.
Yeah, it's because I think it's easy for others to look at that data and have it tell different, the same numbers tell different stories. And so the more that we can just communicate the true story of what's going on, that our mitigation is working, or if something happens and we realize we need to change mitigation to make it work better, just being really transparent with our community, with the safety of our kids.
Ms. Shea, I think that's something that we can reasonably do, and I can reassure all the board members, since February the 22nd, we have only had one transmitted case. So a positive case that resulted in another positive case.
And I think that is a tremendous statistic, and I think it
accomplishment.
speaks
Yes, ma'am.
volumes to our mitigation and is
Absolutely.
important. So say that one more time, just so we can relish in it.
We have only had one positive case that has resulted since February the 22nd in a secondary positive case, so 2 cases that were linked.
Thank you. Tremendous job from your team. That's all from me.
Thank you. Reverend Cooper?
Thank you, Madam Chair. Again, thank you, Ms. Gilbert and Dr. Tigan. A couple questions for me. So, Dr. Tigan, I want to ask first about the self-screening forms. I've been receiving feedback and questions regarding the effectiveness of the self-screening forms. Could you speak to the overall compliance of our families completing the self-screening tools for the students arriving each day? And if a student does not have a completed self-screening form at the bus stop, are they allowed to board the school bus?
We have done the self-screening form too through RICOR and through the family's, compliance with it. The expectation is that they are doing it every day. Do we know the level of total compliance? No, we don't. However, we also are doing random temperature checks in a building, no different than any other year where a child can be put on a bus sick, and they go to school and then it becomes apparent they're not well. I mean, we're doing other things to check for that within our schools. That's same for faculty and our students.
And I would just add to that to make it clear to all who may be listening and perhaps to some of the reasons you may be getting this question. It's not an expectation that you bring a new signed form every day to board the bus. So it's sort of like our student code of conduct, where students sign in the beginning of the year that they agree to these rules. When they have signed in RICOR, and we also had paper forms available, this piece about the daily health screening, they're asserting that they will participate daily in this screening, sort of like they will daily follow the procedures and rules in our schools. So it's sort of an honor system, if you will, as it is with a number of pieces related to conduct in our schools and guidelines for being able to participate in things. You assert that you're going to follow those each day. But, as Dr. Tigan mentioned, there are random temperature checks and other ways that we can monitor adherence to that.
Thank you, Dr. Tigan. Thank you, Dr. Castro. Another question. Since the CDC just recently announced some update guidelines surrounding individuals who've been fully vaccinated, will this have an impact on our health plan or policy?
That's a really great question, and the answer is no. We are adhering to our health plan. We know that the guidance has been if there's people that have been vaccinated that they can be together in a room without masks. We are still, all of our mitigation factors are critical, and we are still, adhering to that mask wearing as being a primary mitigating factor.
So we look at the fully vaccinated perspective as another layer, but not one that
Correct.
causes us to make a paradigm shift, if you will, in policy and procedure?
Yes, sir.
All right. Another question quickly. So thanks again for slide 8, student lunch venues. Appreciate the information regarding the changes, but the question I want to talk about is pertaining to virtual learners. Lunches provided them. With the changes to the meals distribution schedule, are we collecting access data to determine if the number of families accessing the food has decreased?
Actually, I met with our supervisor of school nutrition services, our director, and earlier today, and she does not have data yet from yesterday, but she is going to get us that data. So yes, we are monitoring it.
So it'll be available to access data?
Yes.
Thank you. Because, since we're no longer offering individual day pickups and neighborhood deliveries have shifted to one-day bulk pickup, has there been any consideration with the changes to the packaging of the food and the types of the food offered? For example, I've seen pictures of milk cartons provided to families that contain expiration dates within 1 day of pickup. And so if a family is picking up food for, say, a week for 2 students, the family would receive approximately 10 individual cartons all of which expire within 1 or 2 days of pickup. That's very concerning due to the potential waste and harm this could cause in providing expired food items.
And what was the other discussion item today was just about the sources of our supplies and our food sources and making sure that what is put out there has the shelf life for the time period. There has not been time to validate the information, but that is one thing that we are checking on with our vendors because we use the same vendors as every other school system. And there were conversations prior to going to this delivery time period with our vendors, so there will be follow-up.
Thank you. And I just got one more question concerning the disparities that exist regarding access to healthy, nutritional foods at each of our sites. Just want to kind of get an understanding. I've been hearing about and seeing pictures of meals provided at each site, and I'm concerned about the stark differences across the district. Some parents seemingly are receiving healthy processed items with little to no fresh vegetables and fruit, and others are receiving appropriate servings of fresh fruits and vegetables. And so the quantities also differ, depending upon the school. So the question I raise is, this is a question more maybe for the nutritional department, but could you speak to how the types of foods are selected and how the foods are distributed each site? Because I just want to make sure that there is no disparity, that everyone has access to the same quantity and quality of healthy food, inclusive of vegetables and fruits.
Right, and the great question, and I'd love to be able to provide you with additional information on that. I do know that there are some site-based decisions being made based on normal food consumption, but Ms. Whitney is looking at how those, what's being offered. There are requirements by the federal government as to what has to be included in each meal. And so that drives a lot of it, along with, some student voice and choice and what they'd like to eat that fits that criteria. I've heard, just as an aside, like, why not give a gallon of milk rather than 10 containers of milk? And the federal government won't allow us to do that, and we participate in the government program. So, but we do continue to look at that, and I know we've had feedback on some of the sugar levels and some of the items, and there are changes that will be coming in the next month. It takes a little while to change vendors and get additional food sources, but they have been working on that. So I think you'll see changes coming in food across the county.
And Dr. Tigan, I would add to that, that's absolutely right. Something we continue to monitor. Not only are we looking really closely at the number of meals served, any changes and patterns and data related to accessibility, it's something we want to be really mindful of. But I do want to just reiterate that every meal we serve in every school has to meet the federal guidelines for the nutritional program, and it does meet those guidelines for a balanced, nutritious meal. As defined by our federal breakfast and lunch program. So we are meeting those requirements. The variances may be some site-based, and so we're going to keep looking at that and gathering feedback, and we appreciate those who have brought that to our attention, and we'll look forward to following up with more detail.
Thank you, Dr. Tigan. Thank you, Dr. Castro, for that. Look forward to doing that. Thank you.
You're welcome.
Thank you, Reverend Cooper. Ms. Atkins?
Thanks, Dr.
Good afternoon. Thank you, Mr. Jenks, Ms. Gilbert, and Dr. Tigan for this presentation. I know that our nurses have been at it for several weeks now, and they are serving staff and citizens very well. Can you share with me how much longer do we anticipate our nurses serving in this capacity regarding the inoculations?
I know I can share that right now it's only based on areas, it's choice, and it's outside of their school responsibilities. They have been helping on Wednesdays when that's a possibility, and that's not always a possibility for all schools because there are still some of the limited in-person students that are still coming on Wednesdays. So, but other than that, it's their choice to work outside of their hours, contract hours with us to help on the evenings and helping on weekends.
That's correct, Ms. Atkins. On Wednesdays or days that we're virtual, as in tomorrow, we're half day, we have many of our nurses that are coming to the Raceway after their students leave the building tomorrow. to complete their contracted hours as a school nurse, but giving shots. Some of them will be staying past those hours to work on an evening shift as a volunteer situation. But on Wednesdays, we are committing outside what's going on in our buildings to supporting the Raceway. Now, we look at each individual school and take each child individually, and if we have a medically fragile child at a school or an increased need at that school for that nurse to be there, then that nurse is there at the school. That is her first priority.
I think it's really critical that the priority is our students.
Absolutely.
And outside of that, we're still supporting the community efforts towards immunization.
Taking notes. Do we have any nurse vacancies at this time?
One, yes, ma'am, at Glen Lee Elementary School.
Y'all need to hear him get that filled.
Believe me, Reverend Cooper, we are working on that. We are working hard on that.
Are there any aides positions, nurse aide positions that are,
Yes, ma'am, we continue to have about 23 aide positions available.
what schools are there?
Ms. Atkins, I would have to get back to you on that. I don't know that I could quote those to you right off the top of my head, but I would
That
be
is
glad to
fine.
send that information to you. Yes, ma'am.
No, that's fine. If you could share that with me, I just want to make sure that it stays on the radar, that our nurses are doing just a phenomenal job of doing their job within schools, as well as, providing their services outside of the school. But we also want to keep our eye on the target on these vacancies that we have, because we want to get to a place where we get our kids safely back in school. And when that happens, we also want to make sure we have adequate staff. So I just want to make sure that that stays at top of mind. So thank both of you for answering those questions. I look forward for the additional information, and that's all I have.
And if I may add, take this opportunity to say, we do still have those aid opportunities out there. So if we have any parents or anyone listening into the board meeting today who's interested in helping out at a school and supporting our students as they come back to face-to-face learning, we would more than welcome your application to be able to talk with you.
Any other questions, board members? Thank you so much.
Thank you.
All right, and I also echo thanks to Dr. Tigan, Mr. Jenks, and Mrs. Gilbert for the presentation.